Well, hello everyone. My name is Nathan Woolridge, and I'm the Communications Director for Humanity Excellium. So today, I am welcoming Sunny, who is the project lead of a new project that we've been working on, which is designed to help address food insecurity in our local community. So, based out of Airdrie and surrounding communities. So, I guess right off the bat, I'll let Sunny introduce himself and tell a little bit of how he got involved and just a little bit about what the project is.
Yeah, thanks, Nathan. So, as you guys know, my name is Sunny Dupar. I'm a family physician. I actually work here in Airdrie. I've had a lot of experience in family medicine, being kind of all over the place. I've been abroad for my schooling in the Dominican Republic and the United States, and then coming back here and worked a lot with marginalized communities and underserved areas. So I was always kind of passionate in wanting to make sure that I'm part of the community in some way to give back. And then Humanity Hampers came up because just working here alongside Dr. Olive, we started to notice that more people were coming in during these last months, especially who are having more concerns regarding just food insecurity and not being able to figure out how to pay their bills or put food on the table, how to get food for their children, and started to come up as a conversation that we started to have and wanted to figure out how we can better address it and better be able to do something for the community that we're serving. And that's how this kind of started to take off.
Yeah, for sure. So, do you think maybe you could also tell us a little bit about the communities that this will be serving? So, just what those communities look like, and just obviously you work in one of them, so just a little bit about the essence of the community and just some of the people that are there.
Yeah, so I mean, I'm working out in Airdrie. Airdrie's like a town of about 70,000 people. I'm not exact on the number, but probably around there. And like we're located just north of Calgary. There's a lot of different communities also out here, like Bicycle and other areas that are nearby in the Airdrie area. So it's a lot more rural in that sense. And then Calgary's probably one of the bigger cities that's well known around Canada. And so we're not too far, maybe 20 minutes drive right up north from there.
Yeah. And then I guess maybe the next big question is just maybe if you could tell us a little bit about what the setup is for the food bank. So just where the food comes from and just how everything works together and just what it's all about, and a little bit about like what the philosophy behind this is.
Yeah, so like basically it's come together because we want to do something to help support the people that are kind of in the need right now. And we understand that people go through their life, and at different times in life you might have different needs. And as you're serving a community, to be able to help take care of them, to be able to help their health, um, there's more than just being a doctor to write prescriptions and kind of working on that. So we really want to be involved. We want to be able to know that like we're here for our community. So that's really like why, like what the philosophy comes from, that like you want to be able to do more than just kind of like help someone when they have a medical condition, but also to kind of holistically take care of them as an overall being. There's a lot of data related to food insecurity and health, just health and social determinants of health that affect people and from childhood to old age, and how that impacts a person's health overall. So food insecurity, just looking at it in like Canada's picture and even down to a local community picture, it affects all of us. There's a rough estimate that people have thrown out when I've had conversations, even with like the local food bank, is that like roughly about 10% of the population is living in some form of food insecurity. Food insecurity could mean things like you're concerned about like, are you going to have money to pay for food next month? Or like you're actually like having to pick between products to say, I can't afford this, so I'm going to buy this. Or it could be like I just don't have money for food, so now you're actually in the form that you're starving. There's lots of programs out and about to try to like figure out how to help make these things work. And what ends up happening is not every single program is nearby enough, or people just don't know about them, or people aren't able to access them. And so how Humanity Hampers works is we're right here in the clinic. Like we have, there's other clinics involved with us, like the clinic in Bicycle, the East Airdrie Clinic, us right here in Airdrie, and we're basically letting people know that if there is a concern, if there is any reason that they feel that they're needing food because they're not able to get enough, we don't need to know any more than that. That like they just want the food. So then we're basically helping to try to help make that need be met right now, understanding that it's not a permanent thing, but maybe longer term for some people, maybe just like a one-time thing for some people, as their needs come up. We're basically partnered with a lot of different places around our community. We know that like it's not just us, and we want to make sure that the project that we do is something that we can grow in our community and be part of our community with. So one big thing is just like the local Airdrie Food Bank. We're a big partner with them. That's a place directly where we're reaching out, where if we need food, then we can go to them to help provide the food to our patients, or anyone who's being part of this. And then apart from that, there's other organizations that we've also like worked with. Some organizations that are working to rescue food. And so how that works is there's a lot of food that is really good, um, totally edible, and like some stuff that I would eat. There's a lot of documentaries on this. And then basically from big grocery stores like Save on Food, Superstore, Safeway, even like Sobeys and stuff, there's a best before date on a lot of products, and like a way that they have to market, and a way they have to be able to get food on the shelves and then replace that food with new stuff if it's not being sold. So they start to take things off their shelf before the best before dates often, and this food often ends up either being donated to different places or thrown away. And it can happen in large quantities. So there is a large amount of food. And some of the numbers on that is like almost one third of the food from grown, like from the farm, to like consumption. It doesn't end up being consumed. It ends up going into the garbage. So how do we help in that path? Where can we rescue some of the food from? Is some of the goals of other organizations. They always try to make it a hierarchy. Like we want to get the food to people, then we want to get the food to animals, and then we want to get the food to compost, and then like garbage and stuff. So we are trying to like make sure we can help those different organizations that exist in our neighborhood, to be able to rescue some of that food and get it to people who actually like would use it right away. And a lot of this food is good. You put it in the fridge and it can last for weeks. You put some of the meat in the freezer and it can last for months. So like it's not something that is a big concern in that sense. Some of these organizations are things like Loop or Leftovers, or so like there's different places that you can reach out to in the communities, and that's what we've done. We've partnered with different organizations to kind of like help us do that. We've also partnered with farms that are local, because we are a rural community, so there are farms around. One of the big partners that we have is a farm school, from a great guy who actually runs a school to teach kids how to do farming, how to actually learn about this stuff. So he's a great person that we've met with as well. And so some of the food that is actually not something we can give out or use, that goes to the animals directly, so that the animals can be consuming that instead, so it doesn't go to garbage.
Yeah, for sure. And you just listed like there's multiple goals of this. Like it's, tackling food insecurity, reducing waste, and you mentioned that, it's feeding people but also feeding animals. And also promoting, healthy eating and healthy living. So um, how important is it to tie multiple goals together like that? And how does it feel to like come up with a solution that's not just tackling one thing, but it's able to do good in different areas?
Totally agree. Honestly, when we started this, we didn't know we were going to try to like do something that would be bigger than just getting help for people when they need it. But in all, like, in anything that you do, when you start to go out and you start to meet people and you start to work with people, there are people who have other goals as well. And so like you're working together to achieve one thing, but at the same time you're also achieving other things, which is awesome. So like for us, partnering with some of these places where we can actually get some of the food, and then understanding, well, what happens with some of the food if we can't use it, and knowing how to dispose of it in the best way possible, which means like, hey, if we can't feed people in our community, can we feed the animals that are in our community, right? Like especially in the farms and stuff. And that still is a huge help, because if you think about the farmers who have to raise these animals that are like they're raising them to like run their farm, they also need to be able to feed their animals, and that's a huge cost. And so like people that are going through hard times right now, it's not just us, it's basically everyone, right? Like so if when we started to go and started to talk and we started to like make these connections, we noticed that like, oh, we can get like food, and then we found out that, oh, you don't have to get like canned food, you can actually get food that is like fresh produce. And so all of a sudden we're able to look at like healthier choices for people to eat, and to be able to provide, maybe not on a regular basis but more often than not, right? And then like at the same time we started to make these connections to say like, well, what else like is out there in the community that we can kind of like make these partnerships to help each other with. That's the main goal. We want to help support the community, and help people in whichever way we can.
Yeah, absolutely. And I agree. I think it's really great to have all those tie-ins. You just mentioned something about the quality of food, and I think when I joined you guys a few weeks ago, that was something that was really shocking to me personally. So I
Yeah.
wonder if you can talk a little bit about what the food selection has been like over the past few weeks, and just maybe if you've also been personally shocked by just the amount of food that could potentially be going to waste if it wasn't going to be used, and just the quality of that food.
Yeah, I can tell you I was shocked. I saw like some documentaries first, because I was just like, okay, like let's do this. I think there's a really good one called Just Eat It, and then I was like, okay, I want to learn this. And when I was watching that, even I was like, wow, these guys ate like they ate more food than they were when they were not on this like challenge that they were doing with themselves. And then when I went out and actually started to see some of the food that comes out of some of the stores when they're going out for donations, and sometimes even just like out to waste, that like, hey, we need to get dispose of this. I was like, wow, like these are totally normal carrots or potatoes, or like lettuce and everything, like just really good green like healthy food, and the amount of it as well. So we were shocked, because a lot of times, at least like thinking back when I was little, and you're thinking of like, oh, we're going to do a food drive, so you're putting like non-perishable, or you're putting like pastas, or you're putting like canned foods and stuff into donation boxes for it to go to places. But in this situation, we're actually looking at like, hey, this is like, this is very different. This is stuff that people can take home, and then make different meals out of, and really, if you think about it, in my mind, like if I'm getting this out to people, and if they have some sort of underlying health issue, like at least I know that I'm not giving really high sodium, high concentrated food, or high fatty foods. That's not going to help, or high carb food. Yeah, there is that. But there's also like options here that like at times we can give out like really nutritious food.
Yeah, I think that's a huge thing that has stuck out to me that you've said in the last few weeks that we've been talking, is that as physicians and healthcare workers and stuff, you can tell people to eat healthy, however many times, but if they don't have the means, or they're not able to, it's quite a difficult challenge for people. Hey.
Yeah, yeah, totally.
Yeah. So I guess, so this is being done in partnership with Humani Exilium. So maybe if you could talk a little bit about how you know Humani Exilium, and then just how this project, ties into a little bit of the organization's goals and vision.
Yeah, that again is probably just, I'm lucky, I feel, because I got to be like in a position where I could be a part of Humanity Exilium. Um, Working over the last year with Dr. Alvi, I got to learn a little bit more about it, knowing the work that she's done with the organization to help people all around the world. Even during just the COVID times, being in lockdowns, being able to have some of the online platforms that you guys made to create awareness, whether it was in India or whether it was in Palestine and other places. Like I thought it was very, very awesome that like you can be part of something like that. And then kind of sitting there and talking about how it, I've done some global work, right? Like I've gone around, and like the main point is you want to go and be able to help people who don't have something that you can help share with them. And like we've often also talked about, like, like you don't always have to go outside of your house to do that, right? Like you don't always have to go outside of your community to do that. So being able to kind of like recognize that we can have a project that actually helps meet those same visions, or of like helping people who don't have something to be able to have something. In this situation, looking at health disparities, looking at food insecurity, right? And being able to say like, hey, you can find that any part of the world. We also have that in our own community. How do we help make a project to be able to do that right here? If and that's really like the biggest thing why like it would be a perfect thing for us to do with Humanity Excellium, to be able to build a project that has the same vision that we do internationally, but also like locally in our communities.
Yeah, for sure. And so this project has been running for a few weeks now, I guess, almost for a few months, I guess, too. So maybe if you could share a little bit of just how things have gone, maybe just how it's being received by some of the people who are using this program, and then also maybe tell a little bit about some of the other people that are involved, and just how volunteers are working, and just how things have been in kind of the first few steps of this journey.
Definitely. So like right off the bat, like Sarah, Dr. Elvie, like, and Linda, our social worker, like they've been tremendous in helping, trying to like figure out how to either brainstorm or come up with ways to like sit down and work through how we're gonna make this project a reality. We Mark and Lindsay, like a couple farmers that have been very supportive and really given us some connections in the community to be able to say like how do we really like build that. And all this came right through our clinic, like right through working here, speaking to our people that come through our clinic. So it was really nice to be able to take that right from the community in that sense. Um, every single project you do has like ups and downs and hurdles that you learn, that all of a sudden like, what do we do here, what do we do there? So one of the biggest things I can tell you is I never thought that I could do something that would become some sort of community project, right from working right out of our clinic type of thing. Like I always thought you have to have like a big, backing and like lots of like materials and stuff like that. But things just started to come as we started to look out. One of the things that Dr. Alvey recently said to me is that it sounds like all we needed to do was ask, and there were people there willing to like kind of step in and take some initiative and stuff. So we've done that. We reached out to the food bank. We reached out to places like Loop and Leftovers and Harvest, and like they've turned around saying like, how do we help you help others? The biggest thing that we noticed is that everyone recognizes that there's challenges in accessing these resources. So like sometimes you might not want to say like, oh, I don't feel right going to the food bank because I don't feel like I'm in that level of food insecurity, but I do have this food insecurity and I would like benefit from this. So like if you feel more comfortable speaking about that with us, and just knowing that we have this organization that will do this anonymously, then like I would rather like be able to do that. And that's what the partners say. Like they'd rather partner with us and get this out to people than to say that like, oh, you have to do it through this one path, right? So that was a great thing that we learned in the community while this has been going on. And like, we grew small. So like we didn't really advertise it. We just kind of told some of our people going through the doors, and like they started saying that like, yeah, we would really benefit. So we started taking one box at a time and started to build. We recognized that like, oh, this is, we need to figure out how to do pickups, how do we organize everything. We needed volunteers. We reached out and we asked for that. We had people come up and say like, we'll help you coordinate, we'll help you get the volunteers. We have like amazing people who've come in and said that like, you know what, there's the Rotary Club or there's this other thing, and like let's go present there. There's people that would want to take part in this, and like so we're setting up other things. And it really is just taking that first step and just reaching out to the community and saying like, we would like to do something, and starting the conversation. And all of a sudden you have you're almost enabling and giving, empowering, I guess is the right word, to others around you to be able to say like, I've always wanted to do this, let me do this with you guys. So like we've had a lot more people, and I think the response has been really good in that sense. When it comes to like handing out the food and like the people that are actually getting this, I've had times where I've handed this out and gone and even delivered to some people who haven't been able to actually like transport themselves to where we do the pickups. And like I've had just conversations where they're saying that like they're super grateful. Sometimes it's some of the best food they've had in like weeks or months because of like how some of the produce that we get is still very fresh at times, and we're able to hand that out. And people are very, very good at understanding that like, hey, like you get this, you can store it. So like I had one of the people tell me that like, oh, I got this last week and I made this and this and I put it into the freezer, and I you know, like I can use this for like so long, and I'm so grateful for this or that. And so it's like you the response has been really good. The response um, is not just about like the ability to eat, but like I remember one of the people's that like came on, it was related to just being able to know that like they have the support so they can take care of other things in their life, especially like the bills that they're trying to pay but not knowing how to get the food. And sometimes if you can just help someone throughout that part in life, eventually they're not going to need you. Eventually they're going to be able to catch up enough so now they can be the person to just go back to being independent. And that's the goal. Like the goal is not to just be the person that's going to give out food. The goal is to help the person in the time of need so then they can get better and keep going, moving forward, and getting better in their life.
Yeah, definitely. So, yeah, it sounds like it's having such a huge impact. So for people who are, maybe listening and wondering, oh, this sounds like something that could benefit me. What are some of the ways that someone can be able to access food through this program? And then also for people who are interested in getting involved and helping out, what does the volunteering side look like as well?
Yeah, so we're still, like wanting volunteers, and we understand that we're going to slowly grow bigger and bigger, and wanting to be able to help people, not just one day a week, but to do this multiple days a week or every single day of the week. And that all comes from the volume of the volunteers that we get to be able to do this on different days as well. So volunteers wise, like, it can be whether you're coming out to help sort the food, package the food, to put it into boxes, or hampers type of thing, to helping with like the delivery of it, to like like have the curbside pickup and make sure that it's being given out, and people are getting access to it. We have a wonderful coordinator that's helping us kind of coordinate that stuff. So like just reaching out and getting your name in the list so then we can reach out and let you know where our needs are and we can coordinate with that. For people who would like to take part in this, that would be more of like right now. Currently, we're doing it through the 3 clinics, but like as we continue to expand, just reaching out to us and saying like we would like to get access. And we have like a very simple form of just making sure like, hey, if you can't have dairy, like we just want to make sure we're not going to give you stuff that like could harm you and stuff. So a simple form of recognizing like what it is that like we should be getting out to you, and then like for how long it might be that you need it for right now. And we typically just have like a, once we get it out, we'll do like a survey saying that like how's the food, was it enough, do you need more, and like would you be like requiring a pickup again the next week. So that way we can kind of get a little bit of understanding of how much need there is and try to make the best to make that need met, every single week.
Yeah, definitely. And are there any limitations to access, or I know a lot of people have had questions about if they have to meet any certain criteria or anything like that.
So right now we don't have any like specific criteria. If you say that you have a need to be able to access food, we understand that and we're just going to try to help you. For the limitations on like how long, like we don't have that either. The limit's probably more of like how much donation we get in. So like yeah, like if like we'd like to give you as much as we can to be able to provide in the time of need, but we also have the limitation of how much we're getting, and trying to make sure that like we have resources to be able to provide that food for everyone.
Yeah, definitely. So we've covered a lot. Is there any other information or anything else that you'd really like to share about this project, or even just something that you've learned just in the short time that this has been running so far?
Um, I I think like the greatest thing is um, one of the people, I think it was Mark who runs the farm also. He basically said that like we can talk all we want, but it's all about doing. And like oftentimes you have to do to learn. Um, he is a teacher at a farm school and he's not a farmer. And he's learning to farm as he's teaching. And so I think it's really inspirational to see things like that. And so like I can tell you I have no idea in the setting of like running an organization for like food insecurity, but like I did take that to heart and say like if we're going to do this we just have to do this. So as we go we'll learn, and that's the whole point. That's what medicine is about. You keep learning every year. You'll never know all of medicine, but you'll keep learning new things and seeing new things that are coming out. And that's the same thing with these type of projects. Like you just gotta start it and know that you're going to learn all along the way.
Yeah, absolutely. I guess I'll kind of finish things off with, obviously it's kind of still early in this project, but where do you kind of envision it moving forward and going into the future, and kind of where do you hope that this can maybe expand or be able to help more people in the future?
So I think one of the things that I took from this also is just understanding, apart from just the food insecurity that we're working with in this setting, but like recognizing that there's a lot of food waste. When I started reading about this and I started reading papers and I started looking at it from a community to a federal level, all of Canada in that setting, and there's so much information regarding like food waste. And so like the fact that we know that this is not just like happening right here in my neighborhood, it's happening everywhere. And I'm pretty sure that like there is food insecurity everywhere, and there's a little bit more of a need right now, especially with like how much people are affected with COVID. My biggest goal would be, as we learn how to do this in our community, we teach others in other communities to do this, to be able to create like humanity hampers everywhere. In any community where we were out there, and like through like just goodness of people like helping rescue food from it being put into the garbage, because it just breaks my heart to see the amount of meat that like is being produced from like that's not being sold, that might be going to the garbage. The amount of produce and stuff that's just being thrown out. We should be able to get this to people who actually need it, and we should be able to try to like reduce the amount of like waste we're producing as like a whole society. And so like that would be the biggest long-term goal, to be able to say like, can we do this in every community?
Yeah, absolutely. So again, I'd like to really thank you so much for joining me and making the time to have this conversation. And yeah, it's been so amazing watching the journey and process of this unfold, and just how hard that yourself and just everyone else involved there, everyone is super passionate about this, and it seems like the volunteers and everyone that's involved is almost like their own small community itself. And
Yeah.
it's really great to see everyone be really excited about this, and I'm excited to see where things move forward. So again, thank you so much for joining and sharing more about this project.
Well, thank you, Nathan.